everyone, and welcome to my channel. Another video about how to become a clinical pharmacist. In today's video, I decided to show you how much are you going to get paid as a clinical pharmacist. You might be interested in pursuing a clinical pharmacist position, and you might have heard a lot of myths about the fact that a clinical pharmacist might get paid less than a regular pharmacist position. So I wanted to show you and compare salaries so that you can make an informed decision based on today's information. Now, if you like my content and if you're new to this channel, subscribe to my channel and hit the bell so that you get notified about future videos. This channel talks mainly about how to become a clinical pharmacist anywhere in the world. I'm broadcasting from Canada, and I've been practicing as a clinical pharmacist for over 20 years in North America and so many other countries in the world. Now let's get started. I'm here on Indeed, and this is actually Indeed Canada, and a lot of you know about Indeed as a website that you can Google or search for jobs anywhere in the world. Depending on where you are and where your browser is located, you might if you look up Indeed, you might go to Indeed in that country wherever you live. So a little trick, if you're looking for jobs in North America, for example, when you search for Indeed or for jobs in North America, and you type Indeed, make sure to specify the country. So say Indeed USA, for example. Let's see, this is an ad down here. It will be Indeed.com, and USA Jobs, this is the link you want to go to. If you're looking for say jobs in Canada, also down here it will be ca.indeed.com, and this would be the Indeed Canadian jobs. And the reason we're doing that is because if you say you live in Pakistan or India, it will immediately, if you look up Indeed without putting a country, it will immediately take you to this Indeed here, which is the Pakistan website, automatically, because your internet is running in Pakistan. So if you look up clinical pharmacist jobs, and let's take off Pakistan, and I try to put, for example, New York, because you're looking for jobs in America, and you click enter, it's not going to give you any results because you are in Pakistan's Indeed. So it's not going to give you any jobs. It will give you only jobs in Pakistan. So just for your information, I know most of you know about this, but yeah, if you're looking for jobs in specific countries, just choose the Indeed for that country. Now let's take a look. I'm here in Canada. I'm going to look up clinical pharmacist jobs. I don't know why it keeps giving me Abbotsford. Let's look for Ontario. Excuse me, my mic almost fell off. And here we go. We've got some results. And we got results for clinical pharmacist, and we got results for staff pharmacist as well. So that's good, so we can compare. And there are some part-time, and I'm going to explain the difference now in a minute. Now, maybe in some countries, these terminologies are not used very often, such as part-time, relief, full-time, temporary, permanent. There are so many terminologies here in North America that you might not be familiar with. So always be very careful before you apply for a job, because you don't want to apply for a job and then find out that, oh, it's only 3 days a week and you didn't know about it when you applied for it, or it said something on the job description that you didn't pay attention to. And I'm going to show you in a minute an example for that. Now, see the first one here, clinical pharmacist at the Medical Arts Dispensary of Ottawa, and it's actually a part-time job. And even though it says 8-hour shift plus one, that would make you think, oh, that's a full-time job. No, it's not. It's a part-time job. And it doesn't mention how much they're paying, but this definitely is going to be less than 100 hours a week. So maybe, 100 hours a month. So maybe you'll be doing maybe 20 hours a week only instead of 40 hours a week, which is the usual. Or if you deduct the break time, it will be like 37.5 hours a week. That's the usual for full time. This one will be definitely less than that. We can click it and see if they say anything about the hours. Oh, here, 24 hours per week. So this is a part-time job. It's a Monday to Friday, but you're not going to be working Monday to Friday. You're not going to be working 5 days. You see how this is misleading? You're going to be working only 2 or 3 days max a week. Sometimes you'll be doing 2 days, and sometimes you'll do 3 days maybe. I don't know how they manage it. So be careful before you apply for these jobs. Unless this is something you're looking for, a part-time job, then otherwise, yeah, just look for a full-time permanent job. That's what you should be looking for. Now this one up here is the same. I'll scroll down. This is a staff pharmacist that pays $50 to $60 an hour, but again, it's a part-time job, and it's a day shift, so you don't work overnights or evenings or anything like that. So even though the pay is really good, this is a good pay for a pharmacist. It's only a part-time job, so maybe 20 to 24 hours a week again. Let's see. Day shifts. It's actually 32 hours per week. So this is including your breaks. So if you deduct your breaks, it'll be less than 30 hours. 30 hours a week. Again, if this is something you're looking for, feel free to apply for it. But if you're looking for a full-time job, which most people would be looking for, then yeah, this is not gonna be good for you. It's not worth it. All right, let's keep scrolling. I don't seem to see. There's one in Shoppers here. This one says full time and a clinical pharmacist. So this one should be at least 150 hours a month. No, not at least. Actually, this is the max you could work. 150 hours a month, and it doesn't mention the pay. But yeah, if you click on it, scroll down, they probably won't tell you the hours because it's a full-time. We know full-time would be 37.5 hours a week, and then 150 hours a month, including your breaks. I'm trying to find the salaries here. This one is a clinical pharmacist at St. Michael's Hospital, and it's like a specialty position too. You'll be working in the OR at the pre-operative services and pre-admission, and this one pays $42.88 up to $55.75. Now, what determines which pay you're gonna get? How would you know if you're gonna get a $42.88 or $55.75? What determines that is your experience. How many years of experience did you have before you apply for this job? No. Pay attention that this is an evening only job. So if this is something you don't want to do or you can't do, then this job is not for you. However, it's a full-time, and here's the pay, $42.88 to $55.75. So that's a pretty decent pay. Let's open this job and take a look at it. And it's a permanent. That means you get a permanent line. That doesn't mean that you that means that you will be there for as long as you want to be, as long as you're doing your job properly. You're not covering somebody else's vacation, for example, or somebody else's leave. Now here is a little bit brief about the hospital, and let's take a look at the duties and responsibilities here. What are what do they want you to do for this position? So number one here, provide direct patient care in the management of drug therapy to achieve positive patient health outcomes, primarily for patients of the preoperative areas, such as the OR, which is the operating room, the PACU, the first day surgery, and pre-admission clinic and coverage to other patient care areas as needed. So there are other areas as well that you might be asked to cover that they did not disclose here. So just pay attention to the fine print here, because you may be asked if you like surgery and this is like your dream job here. You might want to ask in the interview, what are the other areas that you're gonna make me cover? Because if it's like pediatrics, for example, and you don't have any experience in pediatrics, then you might want to rethink the job. And a PACU is the post anesthesia care unit. So basically, it's all surgeries. I wouldn't assume that they will give you areas that are not in the surgical field. It seems like they need someone who has surgical experience and is willing to work in the surgical environment. And then they describe the direct patient care focuses on review of medication orders, selection and assessment of patients requiring pharmaceutical care, identifying, resolving, and preventing drug-related problems for a subset of patients, patient education. I'm not sure what are you going to educate patients about in a surgical unit. Usually a surgical unit has a really high turnover, very quick turnover, so patients come in, do the surgery, and get out quickly. So I'm not sure what patient education you're going to provide, but maybe they need that too. But as a clinical pharmacist, we do that as clinical pharmacists, but on other units, not surgical units usually. Medication reconciliation, which is very important. I'm going to talk about that in other videos, so make sure to check out the other videos as well. Patient continuity of care, and the provision of drug information. So these are all basic clinical pharmacy jobs that you would do anywhere, not just on a surgical unit. And they were kind enough to describe what they want from you. Number 2, regularly participate in the development, revision, and implementation of preoperative standards, protocols, and procedures, and guidelines and programs pertaining to drug therapy, which is very important too. Most of the time, if not all of the time, there are designated people for these type of jobs. It's not just any clinical pharmacist who would go and attend these meetings about revising protocols and procedures for a unit, surgical or medical or any other unit. And I'm going to talk in another video about what do I mean by protocols and procedures here. Like usually, briefly, I'll give you a brief here. Usually any hospital and any unit in a hospital will have a set of pre-printed orders. When the patient gets admitted to that unit, that set of pre-printed orders will be printed out for the patient, and it has basic medications, basic tests that we have to do for the patient. You can add on stuff, not you, the physician can add on certain medications. Like for example, I want to add on an antibiotic for this patient, an intravenous antibiotic. I want to add a let's say a normal saline bolus plus infusion fluids. I want to add TPN. I want to add on anything, but there's always a basic set of orders that every patient will have. It will contain like a bowel protocol to avoid constipation. It contains something like a DVT prophylaxis in patients who can't mobilize and stuff like that. So every now and then we have to revise these protocols based on the newest and up-to-date data that we have on different areas and different specialties. And yes, a pharmacist need to be there to give their input. So whether it's you or they are asking you to do that, so that's one of your job descriptions. You need to be prepared for it. And I'm going to discuss that in another video in more detail. They also want you to support drug distribution throughout the hospital, including central week and evening, as well as occasional overnight shifts. You see here, now this is not mentioned in the job up there in the job description, but it's mentioned down in the duties and responsibilities. So you'll have overnight shifts. Even though this is only an evening shift position, but down here it says you will have some overnight shifts and some weekend shifts as well. And this is not going to be clinical, it's going to be distribution. That means dispensary. You're going to be working in a pharmacy at the hospital, the inpatient pharmacy, and you will be supporting that pharmacy during overnights and weekends. So yeah, make sure always to read this duties and responsibilities part, because you will find more information here that you may or may not like. The next point here: to facilitate and promote accurate, safe, appropriate, and cost-effective use, and to monitor drug use within the assigned patient service program, which is something any clinical pharmacist does as well. I'm going to explain that in another video. Basically, how do we make medication use evaluations and stuff like that to make sure that we are following cost-effective practices where we work, and also to promote effective use of the drugs instead of misusing certain drugs, such as vancomycin, for example, which is every now and then gets misused a lot in the hospital, vancomycin infusions. And then the last point: to support and participate in educational and research programs and projects sponsored by the pharmacy discipline or hospital, specifically teaching pharmacy students and or residents. This is also something that all clinical pharmacists do all over Canada and in North America. We teach students from different universities in Canada. We teach in the residency program as well. So this is not very difficult to do. You need to agree on doing it before you sign your contract. So you can't say no in the future. It says in the contract that you will take students. Now, qualifications they want from you: they want you to have a registration as a pharmacist with Ontario College of Pharmacists Part A. And I'm not really going to go through the registration process here. I might have a video or two about how to register as a pharmacist in Canada, but this is basically not what I'm talking about in my channel. I would assume that you already finished all that and you're ready to be licensed in Canada. This is basically what you should do in order to get a pharmacist license in Canada, just a general pharmacist license. They also want you to have a hospital pharmacy practice residency or equivalent experience. Now, don't let this discourage you from applying because it says or. So you don't really have to have a pharmacy practice residency, but they give priorities for those who have a residency because they've already been trained as clinical pharmacists, as opposed to someone who's coming from a different country with massive training, but he or she do not have a clinical pharmacy training within Canada or within America. So, however, not all clinical pharmacists are, or not all residents are, or may be interested in this position. So maybe they didn't get anyone interested who applied for the position, which would give you the priority because you have the equivalent experience. So if you apply, you might easily get an interview and you might even get accepted. Okay, now they want minimum 1 year of relevant clinical experience in providing pharmaceutical care to patients in a teaching hospital setting with medicine or surgery experience preferred. Again, they need at least 1 year of clinical pharmacy experience. It didn't say within Canada or within America. It says just 1 year of relevant clinical experience, and it could be in a medical field or in a surgical field. It doesn't matter, but that's what they prefer. Now, if you have a year of experience in pediatrics and you apply for this job, you still might be accepted, but your area of expertise is completely different from what they're looking for. So your chances might be a little lower than someone else who has a year of experience in general medicine, for example. As those clinical pharmacists have worked with an adult field of medicine, so they would be preferred over someone who worked with only pediatrics, which is a completely different field. Student and patient teaching skills, that's easy. Any pharmacist has pretty much that expertise. Excellent communication, interpersonal, organization, and problem solving, that's general. Interest in research involvement and demonstrated potential for scholarly activity, meaning that they might ask you, or they prefer if you have research experience, or at least you'd be interested in doing research and publishing reviews and articles for the hospital, because that basically would make their area, the surgical team and the hospital, make them more famous, because you're publishing and your name is there and the hospital name is there, so that's something good for the hospital. But it's not really a must that you have to publish something while you're working for them. It's just there to tell you that this actually is something that we like to see, but you don't have to do it. Commitment to philosophy of pharmaceutical care and mission and values, again, that's general. Must have an excellent attendance record. Okay, of course, yeah, you need to be prompt. You need to be on time. You can't be sloppy and all that stuff. That's just general. Like, I don't know why they put that there, but it looks like they had trouble in the past with other pharmacists, maybe, and that's why they had to put it there. So this is an example here of a typical clinical pharmacist situation, and this is actually, I'm glad we got this because it's a very specific unit, a surgical pharmacist position. The hospital has like 4 stars based on 155 reviews on Indeed, which is not bad. But again, I didn't like the fact that they said it's an evening shift. They didn't mention anything about dispensary here, but they mentioned it down here. And they didn't mention the overnight shift as well, but they mentioned it here. So anyways, you just have to pay much attention to the job description before you apply. The rest of the jobs here, okay, here's another one. A pharmacist candidate. I don't even know what that is, but it's a candidate to becoming a pharmacist, maybe a student who is about to become a pharmacist, I'm not sure. And it's in a hospital, and they pay a little bit more. Let's open that one up. But basically talking, this is what you get paid as a clinical pharmacist in Canada. It doesn't go above that. As a pharmacist in the community, you're gonna check it out soon, but it usually is less than this. But let's take a look before we judge. This one is an Ottawa hospital. It's a really big hospital. It says 1,100 beds and approximately 12,000 staff members. So that's a really big hospital, and it's pretty much going to be a teaching hospital for sure. This one jumped immediately into the requirements, which is a bachelor's or an equivalent combination, registration as a pharmacist, working knowledge of modern hospital care and drug therapy, in-depth understanding of use, composition, and clinical effects of drugs. Everything is general here. You can see there is no mention of a residency on this job, which is great. Great for international pharmacists. Of course, a resident can still apply. From the compassion of people, relentless pursuit of new discoveries, blah, 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 blah. It doesn't really say where you're going to be working. And why is a pharmacy candidate? What do you mean by that? Okay, there's a pension plan, insurance protection, all that stuff. I have no idea. It doesn't say. I guess you have to contact them to know. It doesn't say where you're going to be working, what hours, nothing at all. Okay, let's take a look at, now we know how much a clinical pharmacist gets paid in Ontario, and one more thing I need to add, this pay could be different from one province to another. A clinical pharmacist in Vancouver gets paid pretty much similar to this number, but in Alberta it might be different because Alberta usually pays more for pharmacists. Now let's take a look at just a pharmacist, and I'll keep Ontario as a city. Or yeah, we can change it later. We can look at other places and provinces later. But here, this is a pharmacy manager, and look at this number here. Okay, I'm glad they put this number here. This is in Ontario and somewhere called Port Hope. It's a permanent position. They want a pharmacy manager slash pharmacist at Pharmacist. Pharmacist is like a big chain supermarket, superstore, and they're paying 115 all the way up to 164, 679. I don't know how they came up with that number. Now let's take a look at that number. You're not going to get that number in your pocket for sure. This is before taxes, so they will deduct. Sorry, why doesn't it move here? They will deduct the taxes before they pay you. But let's say you will get paid 115,000, and that this is annually, a year. Okay. Deduct 33% approximately. So this will go away to taxes. So you'll get paid 77,000 a year. Of course, you don't get paid that much right away. So divide by 12 months. So in a month you get paid this amount after they deduct the taxes. But once again, you don't get paid on a monthly basis in Canada. You get paid on a bi-weekly basis, so every 2 weeks. So divide that by 2. So you should expect 3,210 every 2 weeks. This is actually a very good salary here in Canada. And this is the minimum. We use the minimum, which is 115,000. If you have a lot of experience, you can get paid 164,000, and that would be even more than this, way more than this. Now, I don't know what's the tax category for this one, but you probably get paid more. You pay more taxes. You end up paying more taxes for the higher amount. I'm not quite sure. You can check out how much tax you would be paying for that sum. You find online information for sure about that. But this is a pharmacy manager. We're not looking for a pharmacy manager now. Here is a locum pharmacist, and the pay is $45 to $48 an hour, which is quite similar to the pay of a clinical pharmacist at a hospital. However, look at the shift hours. It's a 10-hour shift, not an 8-hour shift. So, and even for the pharmacy manager, it's a 12-hour shift plus 2. So you can end up working up to 14 hours a day. So that's a lot of hours for this pay. So that explains why it's too high, probably, because you're not doing an 8-hour shift. You're doing a lot more than an 8-hour shift. Here's another pharmacist, and they're paying from $53 an hour, but it's a part-time. Okay, it's an 8-hour shift, but it's a part-time. And here is clinical pharmacist. We already looked at that. Staff pharmacist, 50 to 60, again similar to a clinical pharmacist, but it's a part-time job. So they're full-time here, $52 an hour, full-time shift at Shoppers, which is pretty decent, and they're urgently hiring too. So just FYI, you can see that Shoppers has a 3.7 stars here. Shoppers Drug Mart is one of the most famous chain pharmacies in Canada, and they receive a lot of patients on a daily basis. When I go to Shoppers as a patient to dispense my medications, I drop off my prescription and I immediately get notified by the technician or the pharmacist that it will be at least 2 to 3 hours of wait before I get to dispense my medication. That's how busy they are. They're so busy with too many prescriptions, and there's only a limited number of pharmacists on duty that they cannot give you your medications right away, or at least within 15 to 20 minutes, like what usual pharmacies do. So if you are planning, most people go to shoppers to work at first to gain some experience, and I would say, yeah, sure. But if you're planning to do that, just keep in mind that this is one of the busiest places in Canada when it comes to pharmacy work. Yes, you're gonna get paid $52 an hour. Yeah, you're gonna work 8 hours a shift, but you're going to do so many stuff that um, combines a pharmacist job, a technician's job, an assistant's job, counseling, everything within 8 hours. So it's going to be very exhausting for sure. Not kidding. You will be very at the end of your shift of your 8 hour shift. You will be uh, your energy will be you'll be drained. You'll be very very exhausted. But yes, it pays really well. $52 an hour for a pharmacist job in the community. That's a pretty decent pay. And here's another pharmacy that pays even more, but it's a part time. I see that part time. There's a lot of part time jobs. Now, okay, I'm glad I found this job. This job says pharmacist casual. Okay. Now you might not have heard that casual term before. It pays really well, up to $56.77, and it's a full time, but it's a night shift. So you'll be working overnights, usually 12 to 8 or 11, like 11 p.m. to 7 in the morning or something like that. Um, Now, casual means you will be covering for someone else. Someone is on leave for some reason, maybe someone having her baby and she'll be away for a year. So they want someone to cover her shift, and that's when you come in as a casual. That means whenever this person comes back from their leave, you have to leave. You can't stay. So it's not a permanent job. It's only a temporary job to cover for someone else. I just gave an example for the maternity leave because that's the most common thing that we see when we see these casual jobs here in Canada. But it could be anything else. It could be someone who had an injury and has to go for a treatment for like 6 months or so. So as soon as they come back, they can come back after 1 month. It doesn't matter. They can come back tomorrow. So whenever they come back and they're ready to work, you have to leave. So be careful. This is actually a mental health center. It's a pharmacist job at a mental health center, so you need to have maybe some experience with mental health management, and it is a casual. Now, I think we've had some good idea about the salaries in Ontario. I just want to show you the difference. Let's look at Alberta, for example. Alberta. And here's a staff pharmacist, but it doesn't have a salary. No, here's another one. Licensee pharmacist. This is a community pharmacy. It's in Medicine Hat, and it pays really well for an 8 hour shift and a full time. You can see the difference right away, right? You can get the feel immediately. The pay is really good. It's a full time job, and it's only an 8 hour shift. However, there's one more thing that you need to look up when you're looking for jobs in Canada or in America. Where is the job located? So this is Medicine Hat. This is outside of Calgary, so it's not in a big city. It's a smaller city, kind of a rural town outside of the big city or outside of Calgary. So it might be a little bit quieter, it might be smaller, maybe a little bit boring, less fun, because all the fun would be in Calgary or Edmonton. These are the two big cities. So yeah, if this is something you're looking for, a quieter, smaller city, then yeah, this is fantastic. And actually, I would love to work in such smaller cities because it's quieter and less traffic when you're driving. Yes, it's less fun, but they have their own fun activities, so you could still enjoy a lot of fun activities. And it's not too far from the big city, so it's like an hour drive maybe from a bigger city where you want to go for bigger festivals and stuff. But you will have your shopping, you'll have everything in a smaller city, so you don't have to go anywhere to buy, say, groceries or anything like that. So this is really good pay. Let's take a look at clinical pharmacist here to see how much we pay them. Now, this is a community pharmacy, 55 to 65 dollars an hour. Let's say clinical pharmacist. These are not clinical pharmacist jobs. Now here's a clinical pharmacist that pays even less. But this is actually a community pharmacy. So it's a clinical pharmacist position, but in a community pharmacy. So that's a different kind of practice. It will involve a lot of counseling patients for sure, but it doesn't involve a lot of working closely with doctors and healthcare professionals, because it's a community pharmacy. You know, they may have their own clinic attached to them, maybe, and then the doctor will be consulting you. I'm not sure, but it pays less anyways. But I'm looking for the governmental jobs, which I don't see here. All of these are what do you call it? It's community jobs. All of them are community pharmacy jobs, but clinical oh, here you go. Oh, it has no salary. Alberta Health Services is the governmental like a health ministry, and they have all the hospitals under them. And a pharmacist one, I don't even think that this is a clinical pharmacist job. It should be pharmacist two. So maybe we should be looking at pharmacist two instead of clinical pharmacist. Let's see if we're going to get any results. Now, you see, if you don't know these terms, you're going to be looking for the wrong thing. Oh, there's no pharmacist two at all, but there's a pharmacy technician too. All right, I'm changing the province, I guess. So clinical pharmacist, let's say Vancouver, another big city here. Oh, look, the same company is also, Neighborly Pharmacy is also in British Columbia. And here they pay all the way up to $75 an hour, but it's a 12-hour shift. Boo. Okay, let's look at a clinical pharmacist in a hospital here. Alright, here, well, they didn't put a salary, but the salaries are maxed at $53 an hour for clinical pharmacists in Vancouver. I know that because I worked in BC. So Fraser Health is the one of the health authorities in British Columbia. They have so many hospitals under them. And let's take a look at what they want. This is a full-time job. It's located in Vancouver. It's at St. Paul's Hospital, so that's a really big hospital. Again, they're asking for the basic clinical pharmacy requirements, what you need to do on a daily basis, and I have so many videos about how to do these things, how to do these job duties and responsibilities. So make sure to check my other videos too. No pay here, but this is for sure going to be an 8-hour shift full-time at a hospital, and you get paid maxed at $53 or $54 an hour. The start pay is about $40 or $42 an hour in BC, which is lower than other provinces, considering like BC is one of the most expensive places to live, especially Vancouver. So I don't understand how the pay works, how they come up with that pay, but it has to be more than what Alberta pays, for example, because Vancouver cost of living is much higher than the cost of living in Alberta or in Calgary or in Ontario, in some places of in Ontario, not all of them, because Toronto has a really high cost of living too. But this is pretty much how much you're going to get paid in different provinces. I really hope that you got some useful information today about how much you're going to get paid as a clinical pharmacist, and where to look up for jobs. Yeah, this website is pretty good, Indeed.com. I didn't go through the American Indeed as well, but you got the idea. You can do that yourself. Salaries in America are much higher than in Canada, which is pretty awesome. So if your destination is to work in America, in the States, then yeah, you can expect to get paid way more than what you're gonna get paid in Canada. Let me know in the comments if you have any questions or if you have any comments about today's video, and make sure to subscribe to my channel if you haven't already done that. I have a complete clinical pharmacist course here online for free, and I also have my my other clinical pharmacist book. If you're interested, you can purchase that book. It tells you all the secrets of clinical pharmacy, how to become a clinical pharmacist in different parts of the world, and which is not going to be different than North America. And yeah, and make sure to give me a like and subscribe on our channel, and I'll see you in the next video. Thank you for watching.